Whether it's today or in 6 or 9 months, we've got to be realistic and accept that there will be more infections, more hospitalisations and therefore, sadly, more deaths, just as there are every year with flu.
Mr Johnson says the approach will be cautious and the different steps will have a minimum of 5 weeks in between.
We will be led at every stage by data, not dates, and we will apply 4 tests. The pace of the vaccination programme, the effectiveness of the vaccines, the pressure on the NHS, and the risks of any new variants of COVID. I can confirm that 2 weeks from today, Monday the 8th of March, we will begin step 1. And schools and colleges across England will reopen and teaching in classrooms can start again. To offer even greater reassurance, we're introducing twice-weekly testing of secondary school and college pupils and asking them to wear face coverings for the rest of this term.
Boris Johnson. The next step will be allowing people from different households to meet, sport facilities to open again, and travel outside local areas will be permitted. From the 12th of April, non-essential retail, gyms and swimming pools can reopen. In mid-May, most social contact rules will be lifted outdoors and hotels can open again. Indoor social mingling of 6 people or 2 households can take place. And finally, in June, all legal limits on social contact will hopefully be removed. Here's the BBC's Rob Watson with more.
But I don't think there's any doubt this is a huge moment in UK's, or perhaps I should say more strictly, England's battle against COVID, because if you strip everything away, I mean, essentially the Prime Minister has been saying, look, if all goes according to plan, all those restrictions that everyone's got so used to and has been up against for the last year, that's it by the 21st of June. So that is a very big deal. So the political reaction, by and large, I think has been pretty positive. I mean, when you think about the desperate trouble Boris Johnson was in 8, 9, 10, 11, 12 months ago when he looked utterly chaotic, his government looked chaotic and unprepared, I think he'd probably be rather pleased with the way things have gone.
The BBC's Rob Watson. Italy's ambassador to the Democratic Republic of Congo has been killed in a road ambush in the east of the country. Luca Attanasio was shot along with a military policeman and a Congolese driver. They were part of a UN envoy when they were attacked in what's believed to be an attempted kidnapping. Italy's President Sergio Mattarelli has condemned the attack.
I just found out a few hours ago about the cowardly attack which led to the deaths of 2 servants of the state, Ambassador Luca Attanasio and police officer Vittorio Iacovacci. They are 2 servants of the state who, in Congo, this morning were carrying out a humanitarian mission for the World Food Programme, and our thoughts go out to all their families, to the relatives of Ambassador Attanasio and Officer Vittorio Iacovacci.
Italy's President Sergio Mattarelli. The BBC's Emery Macumino is in Kinshasa with more.
They say that security or military escort, as it's usually done, was not necessarily. The road has been cleared, and the ambassador did not, and his convoy did not require any military escort. This particular area, the province of North Kivu, has been an hostile region for the last 2 decades, with at least 100 local and foreign fighters roaming in the area. And one way for them to survive is to prey on the local civilians. They organize usually attacks against any convoy to ambush and kill. Just last year, according to a Kivu Security Tracker, which is a program monitoring the security in the area, at least 3 people are killed every day in that region.
The BBC's Emery Macumino. The governor of the province is pointing his finger at the FDLR, a rebel group originally from Rwanda who crossed into DRC after the genocide in 1994. Eugenio Cusimano is an academic at Leiden University in the Netherlands. He's edited a book called Diplomatic Security. Here he is on how security works for ambassadors who've left the capital of where they're based.
All host countries are bound by international law, by the 1961 Vienna Convention, to ensure the safety of foreign envoys and premises. The problem is that diplomats today are increasingly operating in countries that are too fragile and unstable to guarantee host country support, like the DRC, but also Libya, Afghanistan, and others. In these countries, diplomats are vulnerable to terrorism, political hooliganism, and crime. When they dispatch diplomats in such dangerous locations, sending countries try to complement host country protection with their own security forces to add another layer of security, which is exactly what we have seen here. One of the people, or the three people that got killed, was in fact a military police officer who was providing close protection. Sadly, in such dangerous locations, sending country protection may not be enough. They don't have a sufficient knowledge of the local environment, and in cases when armed mobsters are targeting diplomats, it may actually take much more than a handful of close protection officers to repel the attack.
That is Eugenio Cusimano, academic at Leiden University in the Netherlands. In Japan, the suicide rate jumped in 2020, rising for the first time in more than a decade. The number of cases involving women and young people show a marked increase, with suicides among women rising nearly 15%. Specialists say the increase is almost certainly connected to the pandemic and could point to a secondary fallout from the pandemic of people struggling to deal with the psychological and economic pressures. The BBC's Rupert Wingfield-Hayes reports from Tokyo, and a warning: some of the content in this report may be distressing.
I'm standing now in front of Shibuya Station, and the scene here is bustling. There are crowds of people lining up to cross the road. The shops and the cafes and restaurants are open, but the feeling of normality around me here is something of a facade, because behind it, a lot of people are suffering. And for some, life amid the pandemic here is becoming unbearable. In the port city of Yokohama, a 19-year-old woman is undergoing intensive counselling at a suicide prevention centre called the Bond Project. When she was just 15 years old, the young woman's older brother began abusing her. Finally, she decided to run away from home, but the pain and loneliness only got worse.
From about this time last year, I have been in and out of a hospital many times, every month or so. I tried to kill myself many times, but I couldn't succeed. So now I guess I have given up trying to die.
The Bond Project's founder and chief counsellor, Tachibana. Since the middle of last year, she says her staff have seen a dramatic increase in similar cases.
We hear lots of "I want to die and I have no place to go." They said, "It is so painful. I'm so lonely. I want to disappear."
For those suffering physical or sexual abuse, COVID has made the situation much worse.
A girl I talked to other day said she's getting sexually harassed by her father. But because of COVID, her father is not working so much and is at home a lot. So there's no escape from him.
That's June Tachibana ending that report by the BBC's Rupert Wingfield-Hayes. And that's World Watch for today. Kia koe, mani.
Kia ora, Paulina, and that is Midday Report for today. Please stay with RNZ for the latest COVID update. No.
Kia ora koutou, good afternoon everybody. This morning I was advised of a further case of COVID-19 in the community. It's a casual plus contact of one of our original cases and also attends Papatoetoe High School. They had not returned to the school and they had been told to self-isolate at home and get tested for COVID-19. A casual plus contact, for those who are wondering what that means, is someone who had limited exposure to the original case, so as a casual contact, but had been asked to take additional steps to reduce the risk of transmission. In this case, we have regarded other students at Papatoetoe High School as casual plus contacts. We've also regarded all of their teachers as casual plus contacts. So despite the rest of the country moving down alert levels, Papatoetoe High School and their community have stayed at a heightened state of alert, more akin to level 3. The school has remained closed up until yesterday, and all of the students and the teachers were required to self-isolate at home until they had returned a negative test. This was done out of an abundance of caution, and this case was picked up through that testing before they came back to school. We've seen outstanding leadership from the school, as I indicated last week, and I want to again reiterate my thanks to the school principal. I think no principal wants to see their school in this particular situation, and they have responded incredibly well, positively and proactively, and again I want to reiterate my thanks for that. We're asking that all of the students at the school get retested, and some of their household contacts and all of their teachers. And we will have testing on site at the school. If it is not there already, it will be there shortly. That will help us to ensure that there aren't any additional cases and that the virus has been contained. We're asking household members who are seeking a test to go to the community testing station rather than to the school. We want to use the testing capacity that we're standing up at the school to prioritise the students and the teachers. So if household members are being tested, again, please go to the community testing station, and there is a community testing station nearby. I'd ask that we all give the school a little bit of space, be kind, and particularly on social media. This is the early phase of the investigation into this particular case, and we ask people not to pass judgment on others and just simply to let the investigation take its course. The Ministry of Social Development has set up an 0800 number to provide support for those associated with Papatoetoe High School who are required to self-isolate, and information about this and the support available has been passed on to those people who need that information via the Ministry of Education and the school. Wastewater testing continues to come back showing negative results for the Papatoetoe area. That also gives us confidence that there's not widespread undetected community transmission, as does the fact that since last Sunday there have been 70,000 tests processed, of which nearly all have come back negative. So this brings the number of cases associated with this most recent cluster to 9. We always indicated that there would potentially be more cases, which is why we've continued to act cautiously when it comes to this particular school cluster. Catching these cases through ongoing testing is evidence of the system working as it's intended. I'll ask the Director General to run through some of the more specific details from these cases, and then we'll open up for questions.
Thanks, Minister. Kia ora koutou katoa. So in addition to what the Minister's already informed you about, this student lives in a household bubble of 6 people with a sibling who also attends Papatoetoe High but has also not been at school. Testing for all those other family members is currently underway with a mobile testing unit that's gone out. And public health staff are at the moment interviewing both the family and the new case, and we will provide updates during the afternoon if any locations of interest emerge where we need to send a notification out for potential casual plus or close contacts to isolate and be tested. I recognise there will be a lot of questions about this case, and we are working as fast as possible, obviously, to gather all the information we can, and will release further information as soon as we have it. So the public health team and the district health boards are working very closely with the high school, and once again I'd like to thank the school and the wider community for their ongoing support. I recognise that this latest request for all the students and staff to be tested, and also for the families of the school to stay isolated until we have the test results back, will mean that they will be feeling some testing and isolation fatigue. And I just want to thank them once again and acknowledge that they will be feeling that way, and just emphasise how important it is we do get these test results through, and we will get them through as quickly as possible. A reminder also that the high school was closed last week as part of our precautions, and it was only open for the one day yesterday. This student and her sibling weren't at school yesterday. There is whole genome sequencing underway at the ESR lab in Mount Albert in Auckland, and that's being rapidly carried out, and we would expect those results later today. As we have said, we had anticipated there could be more cases from this outbreak. The virus tends to have a long tail. Remembering we are now day 13 since the original school exposure event, which was the 10th of February, when our case A was the only day they were at school. There's nothing to suggest this is a new strain, but of course we will be able to confirm that from the whole genome sequencing. And of course this new case emphasises the rationale behind requiring all students and staff to return a negative test before returning to school. And we did catch this case before this person went back to school. The reason we have asked all the students and staff there to be retested today is we know all our Casual Plus contacts were tested before they went back after day 5 of that original exposure on the 10th of February. However, we want to be sure that there weren't some potential cases that may have been early on in the incubation period and who may have returned a negative test initially and be back at school, possibly asymptomatic, and so we need to just rule that out. A reminder too that all the close contacts, who were the classmates of our original case and the teachers, were all in isolation, where they receive as close contacts a second test at day 12 before going back to school. And we had only one further case from that classroom, and none of our other testing of Casual Plus contacts identified any other cases. On our overall case numbers, I can report that in addition to this new community case, there were 5 other cases in managed isolation over the last 24 hours. In addition, there are still another 10 students from the school who are Casual Plus contacts that are being followed up. 8 of these we are in contact with, and they are being tested. They haven't been back to school. And 3 of the others, there is ongoing efforts to contact, and the Public Health Unit will be working to follow those up actively. None of our previously reported cases have recovered, so our total active cases now is 60, and yesterday our labs processed 4,123 tests with a 7-day rolling average of 10,096 tests. No further historical cases have been reported, and we're still seeing good use of the COVID Tracer app, and we'd like to see that remain at a high level and go even higher. Thanks, Minister. Jessica.
Minister, this may be to the Director General. You mentioned that there may be some locations of interest that you release later on. Why would there be locations of interest if the person was isolating at home?
Yes. The student is in a family of 6, and all those family members are being tested, and of course we may find none of them, in my understanding, none of them are symptomatic at the moment. They are being tested. If we find that any of them have a positive test, then there may be locations of interest, and we will notify those as soon as we know.
But the message was that...
We'll let Jess finish her question, then I'll come to Tova.
But the message was for them to self-isolate, for the students and their families to stay at home. Was that not happening, or...?
I don't have details on that, but that is exactly what the Auckland Regional Public Health Unit is finding out through the discussions with the case and family members right now.
Just following up on Jess's question, so how fastidiously was this family isolating, and how fastidiously, if they were going out into the community, how fastidiously were they contact tracing?
We simply don't have that information yet, but that will be exactly what the interviews from Auckland Regional Public Health will be ascertaining. What I can say, of course, is it's not helpful for anyone to pass judgment on what other people are doing. What we have seen from this school community is really high levels of support and cooperation, and the fact that this student actually did go and get tested, didn't go back to school, shows that there was a level of awareness there, and the family, I'm sure, we're doing
It's
everything.
not about passing judgment, it's about locating or pinpointing locations of interest and ensuring that other close contacts have been identified.
And that's what we will be getting from the interviews from Auckland Regional Public Health. And if there are any locations of interest, we will make those available as quickly as possible this afternoon.
If I could just reiterate it really clearly here, it's important that we allow this investigation to take its course, and that they will look at where there might be additional risk, where there are any exposure events that we need to notify people about. We will notify them about. But I'm aware of the reaction these types of cases generate on social media, and the last thing that we want is people reluctant to come forward and be tested, or to come forward with information we need for the case investigations, because they don't want to subject themselves to that. So my message is not so much to the people in this room, but all the people who are watching, which is just hold back, demonstrate a little bit of kindness. The investigation process will get to the bottom of any additional risk that might be out there, and information will be shared based upon that. I'll let Tova finish that.
Likewise, people want to be assured that the Ministry of Health is working as fast as it can to identify anyone that these people may or may not have come into contact with, and yet you haven't identified any potential close contacts yet, or any potential locations of interest.
No, we haven't yet, and this case was only notified this morning. Around the middle of the morning I found out about it, let the Minister know, and we've geared up two things. First of all, the Public Health Unit needed to contact the family. This was a family that, despite a lot of attempts to contact over the last week or so from our National Contact Tracing Centre, they had been unsuccessful, but of course the message was there that students needed to be tested before going back. They have now been, obviously the Public Health Unit is now talking with the family. What you can also, I think it's also important to convey is, obviously a diagnosis of COVID-19 in a family is something that takes people a bit of time to actually understand and get to grips with. It comes as a shock, and often in that first interview it's just talking about what this means, and then it's subsequent follow-up interviews over the next hours that then go into the details of people's movements. But the point here about what we're doing with the school is, while that process is happening around the case investigation, we wanted to move as quickly as possible while we had the students and staff there to stand up the testing and get those as a precautionary measure, get them all retested.
Jane.
How concerning is this for you with the limited information about a potential outbreak or further spread in Auckland, given we're just one day out of coming out of level 2?
So one of the questions that we would always ask ourselves when a case like this pops up is, had we known about this 48 hours ago, would that have had a bearing on the decision-making process that we went through as a cabinet? And the answer in this particular case is no, it wouldn't, because again, this is a case that is within our kind of known perimeter of risk. It is within that casual plus contacts group that we have already been testing, and that we've already had preventative measures in place, like the fact that they had to have a negative test before they were able to return back to school. So we've seen this with the Defence Force group that we dealt with in November, where we did see additional cases popping up. We were able to manage them within our contact tracing systems. So I haven't seen anything at this point that suggests that we won't be able to manage this within our existing contact tracing systems.
Is the unknown risk, because those questions haven't yet fully been answered by this family. So can you say that the risk is contained or acceptable at this point?
Look, based on what we know at the moment, I'm confident that our contact tracing system will be able to do its job. If the risk profile increases, then of course we will let you know. In the early phases of these investigations, the critical thing is just to assemble as much information as quickly as possible. But as Dr. Bloomfield has said, the less pressure we place on the families in question, the more likely it is that they're going to be able to produce the information that we need to be able to do that quickly. Henry.
Yeah, Dr. Bloomfield, just to be clear, this person should have been tested on day 5 after exposure, right? So the 15th. But you're only just getting a positive result now. So are you saying that they were only tested within the last 24 or 48 hours, or did they return negative in error?
This is the first test the person had, and the test was done yesterday. The important thing about the testing of casual past contacts is that it's not before day 5, so after day 5, which is about the time when most people, if they are have got an infection, will show that infection. Some have a longer incubation period, and so what we're thinking about here is, did this student have a longer incubation period? And if so, if we had tested her on day 5, and we might have missed it, we also want to be really sure there aren't other students in that position, but also just make sure. That's why she wasn't tested until yesterday. That was when she was able to get tested and hadn't been back at school though.
Okay, we'll come over here.
Dr. Bloomfield, was the student not at school yesterday because they were feeling unwell?
Yes, yes, the student had some symptoms, not respiratory type symptoms, more muscle aches and pains. And then I understand just yesterday she did report some loss of smell and taste, and she was tested at a community testing centre yesterday.
Just in terms of the retesting, only some household contacts are being asked to get another test. Which household contacts does that apply to?
Right, so in the first instance we want to retest all the students and staff who are at the school today. There may be members of the households associated with the school who have symptoms, and they should of course be tested at a community testing centre. As we think about this student and those around her, we may well identify other households where we will then suggest that those households get tested as well.
So there's a large number of casual plus contacts outside of the school. What is being asked of those people? Do they need to be retested, and what's the risk profile for them?
So the other casual plus contacts that we have been, that were associated with this outbreak are all related to other places of interest or the workplaces of some of the other cases. So there's nothing additional that those people need to do. At the moment we are focused on the school community where this latest case is a student.
Wasn't the plan that everyone, particularly post-contacts and, the school should have been tested before reopening in terms of students? Did that happen obviously before she was tested, and are there any other people who should be tested outstanding before Papatoetoe opens again?
So the vast bulk of people from the school have been tested and returned negative tests. When the school reopened yesterday, the precondition for coming back to school was that someone had to have had a negative test.
Did the timing, so it was that the school could open and people could come back if they'd had a negative test, but are there still people outstanding in that category who haven't yet returned a negative test while the school was open?
Yes, and as of yesterday there were 11. This student is one, and of the remaining number, 8 have been contacted, are now being testing, and there are a couple who there is still effort going into contacting them. The important thing is they haven't come back to school, and it's just ongoing. So the vast majority of students and staff, casual plus contacts, so well over 90, probably 97%, had already been tested before the school reopened.
Are they concerned though, because wouldn't they be in the same category as the student who hadn't been tested, but still obviously have picked up the infection somewhere along the line?
May have, but all those outstanding casual plus contacts are being actively followed up by the Public Health Unit now.
So all of those 10 casual plus contacts, they do, especially based on what we know today, they do represent potential cases of COVID in the community?
Well, they do, and we want to. That's why we want to find them all and test them. And likewise, we want to just reassure ourselves around those students and staff who are back at school today, who have all returned a negative test previously.
It's so hard to contact them and get these tests done for now?
Look, I think if you think about we're talking over 1,400 people in the school community. Certainly for some of those families, English won't be a first language. We have interpreters involved. There are repeated attempts. I mean, we're talking sort of 10, 12 phone calls, emails, checking with GPs that we have the right contact details. A lot of attempts are made, but now we'll make sure we'll follow that up as well with personal contact and use the school to help us with that.
Would it be helped if you had additional contact tracing resources?
No, not necessarily. I mean, I think if I think back over all of these scenarios that we have had to look at over the last 8 or 9 months, I think back to our August outbreak, we often found with those larger groups, and we had dealt with them with some of the church groups, it was often that last sort of dozen or so people. In every case, no matter how much resource you put into it, it just took some time to get hold of everybody. And, we were putting a lot of resource into those particular, that handful of people towards the end of the August outbreak, just to, really eliminating risk. So, I think my experience of this, of monitoring this all the way through, is that it's often often in those large groups just that last handful of people that take the longest.
Live at Papatoetoe High School, right? And you know that they're supposed to be at home self-isolating, so just rocking around to their place would help, wouldn't it?
Yeah, well, that's why the teams are going out now. So, I mean, again, just to reiterate, we put in this very clear requirement that everyone needed to return a negative test before returning to school, and we saw virtually everybody in that school community, and the tail is being chased up now.
I mean, this is obviously quite a high trust model. Is that, you know, so more than a week on, does the high trust model still work?
Look, I think our entire response to COVID-19 is based on a degree of high trust in our community. When we escalate alert levels, we don't put police officers on every street corner to enforce it. We ask people to do the right things, and by and large, New Zealanders do the right things. When we're dealing with a large group of people, you know, over 1,400 people in this case, what we're seeing is overwhelmingly people are trying to do the right thing, and they are doing what we're asking of them. I think it is important at this point. We don't all, you know, sit and pass judgment on why it took, you know, the period of time it did before these test results came through. There may be other circumstances that none of us are aware of. We just have to allow this investigation to take its course.
About the Pullman Hotel and the report. Have the investigations into the fans been completed, and if so, what did it say, and how likely is it that airborne particles from a bowel movement contributed to the spread?
Look, we are continuing to look at the air quality in the Pullman Hotel and the systems there, including even just, you know, in the last few days, we've had more people in there again, just looking at those air conditioning systems. You'll recall I indicated that initially we would only be occupying the lower levels of the Pullman while further work was done on the air quality systems. And so that work is still ongoing at the moment. We won't fill the place up completely until we're absolutely certain that any remaining issues have been dealt with there. And if we need to put more work into the air quality systems there, we will. In terms of what we've learned from that, of course, we're applying those lessons to every other facility. So every other facility is being looked at through a similar lens to see if there's any further risk. I'll let you finish that.
Thank you. Dr. Bloomfield, is there actually a likelihood that particles can be transmitted through fecal matter? Is that something that's really seriously?
Yeah, I haven't seen any evidence around this, and you know, this is a respiratory infection. It would be. It's not uncommon for these sorts of viruses to be shed in fecal matter, but it's not, in this case and in other cases, a route of infection. I haven't seen any evidence around that.
Jessica.
On the pop-up centres, what's the thought process about closing those down? Will you look to reopen those, and is there enough contingency with the community testing stations at the moment?
Well, we've obviously re-established a pop-up centre in the school to make sure that the testing is available there. Within the community, there is a CBAX already relatively nearby. It's seen a good steady stream of testing in recent times. So it's really a question of making sure that we're getting the resource in the right place to make sure that those who need to be tested are getting that prioritisation.
Has that pop-up closed down and then started up again, or is that run the whole way through?
So there's a community testing centre that's permanent at the in Otara, and of course over the last week or two, particularly in the early days, it had extended hours and more testers there. And the great thing here is I spoke to Dr. Dale Bramley at Waitemata DHB, you know, late morning, and said, can we get testing into the school from the early afternoon to be able to test these students? They rang around different providers, and within a very short space of time we're able to identify at least 3 and subsequently 4 or 5 who were able to get teams in there. And so this is the value of having these teams able to be deployed where they're needed in this sort of situation.
Okay, we'll do a couple more questions. I had one down here in the front.
With this new case, that we're talking about someone who's young, someone who's in high school, and the types of symptoms they're reporting in terms of loss of smell, loss of taste, does that say anything about the severity and length of infection?
You know, every individual seems to have a different response to this virus, and it really just depends on the nature of the symptoms people have. What we do know is if people are asymptomatic and stay asymptomatic throughout, they've got a much lower likelihood of infecting someone else. And likewise, it seems that people that have symptoms like muscle aches, and weakness and not the respiratory symptoms like sneezing and coughing are less likely to infect others as well. So in this case, we're just seeing a pattern of symptoms that are known symptoms, but they seem to be individual.
Yep.
Yesterday there was a new case of COVID-19 in the community that was identified, but there wasn't a press conference called. What's different about this case? What's more concerning about this case that has you calling the press conference today?
That case was already in isolation, so that was a person who was a known household contact of our existing cases, so had been isolating with those. So it was someone we were actually fully expecting we would be seeing a positive test result for it at some point. So no additional risk to the community. They were already in quarantine, and so relatively comfortable with where that particular case was at. This is a little different in the sense that it's a casual plus contact, and so hence we're doing those additional things, again, just out of our abundance of caution approach, to make sure that we've nailed down any residual risk that might be there.
Have you been briefed on this Australian woman who's refusing not only a health check but also a COVID-19 test in Napier and Wellington? And what are the government's options with her?
Look, ultimately, when someone refuses to be tested, which people are entitled to do, they'll find that they're having a much longer stay in managed isolation than they necessarily need to. So in this particular case, if the woman concerned gets a clean bill of health and is deemed by our health clinicians to be COVID-free, then she would be able to leave after 28 days, which I understand is, I think it might be today. So it's a stay that's probably twice as long as it needed to be.
She's refusing health checks at this point, is she not? So what did that mean, that she can't get a clean bill of health?
My understanding is that she'd been refusing testing. I'm not sure about whether she's refused to have any kind of health assessment, though.
Is she paying for that extended?
Sorry, what was that?
Would you consider deporting her?
Not at this point.
And is she paying for that extended stay, or is the taxpayer?
No, I'll come back to you on that one. I don't have that information.
Do you know anything more about this case?
No, I don't.
Yeah.
Why would you not consider deporting her at this stage?
Look, ultimately, people have a right to refuse testing. We'd encourage them to be tested, and the vast majority of people who go through the facilities are tested. My understanding is that this particular person is intending to return to Australia anyway.
Isn't it a requirement of being in New Zealand, being tested? If they fail to meet that requirement, don't they need to be sent back?
Look, it's not something, this case has just sort of emerged in the last, well, I've become aware of this case in the last sort of 24, 48 hours, so it's not something that I've spent a lot of time looking at. There have been a few other things on the go, but at this point, I'm not proposing to take any further action on it.
Lockdown activists trying to make some kind of big legal case happen, trying to get some publicity for this. Doesn't that suggest that there could be more to this than someone who just doesn't want to?
Look, I think it's unfortunate when people buy into conspiracy theories that they read on the internet and base their decisions on a matter as important as COVID-19 based on misinformation.
How concerned were you about reports from the allegations from the Mental Health Foundation that Ministry of Health officials were effectively gagging and threatening to revoke funding for criticism of the government?
I was concerned about the relationship between our organisation and the Mental Health Foundation, because I know we're both organisations are really committed to improving mental wellbeing in New Zealand. So I know for a fact that two of my senior people are meeting with Sean Robinson from the Mental Health Foundation later this week, with the express purpose of making sure that we iron out what the issues are and get the relationship back on track.
So you're going in chief to chief with Sean?
I'm not personally, but two of my senior executive team members are.
What assurances have you sought from your executive team members?
From
the people who dealt with Sean in the first place?
I'm confident in my executive team members and the nature of the interactions they have with Sean, but of course, people bring different perspectives to and from conversations, and we'll make sure that we've just got an opportunity to iron out any issues and focus on our collective mission here.
We will need to wrap up shortly, but we'll take a couple more questions down
back
back
on the
here.
Pullman report. So the emerging evidence is that ventilation has posed a risk. Why did it take an outbreak for the ventilation systems to be reviewed at the hotel?
I wouldn't necessarily agree with that characterisation. We have always been looking at how we can minimise risk within our facilities. We've had infection prevention and control audits done of these facilities roughly every 6 weeks, and every one of those where they've come back with recommendations for improvements that can be made, and they have looked at things like the airflow within those facilities, and where they've come back with recommendations for improvements, we've been making those improvements.
And So, and then back on the famous lift button transfer, is it now is now the theory that it was airborne particles within the lift, or are we still?
I haven't gone back and looked at that case, that particular case. It'd be very difficult to look back at that retrospectively, but it's certainly the potential for stagnant air to remain in a lift for a longer period of time is something that we are taking steps to reduce by the installation of HEPA filters on the lift air conditioning systems.
Sorry, that is being reviewed across the whole MIQ.
Yeah, so everything that we've learned from the Pullman, I can't say that it's all been actioned immediately, but everything we've learned from the Pullman, we are looking at making sure that we've transferred that knowledge to our other facilities.
Minister, can I just confirm, has the lift ventilation been fixed yet?
At the Pullman it has, yes.
Yeah. And was there any rush at all to clear the Pullman by the Ministry because of that pressure on MB that we needed to fit in everyone with MIQ vouchers?
No, not at all. I mean, it would be tight. We could cope with the Pullman being offline for a bit longer if we'd needed to. Obviously, it's easier for us to be using some of the Pullman, and at the moment we've made the decision to use the lower levels, and we won't fill that all the way up until we're confident that those upper levels, any issues associated with those have been addressed, and particularly the stuff around the lift and so on. So I'll let the Director General comment on Health's advice, but I was confident in the advice that I got from Health. So,
yeah, just to confirm, there was no pressure brought to bear, and we had a good team of both public health and MB folk and local regional public health people involved in the assessment, and I gave very full advice through to my counterpart at MB on what would need to be in place before it was reopened.
This is exactly the reason we have a contingency, so that something happens, if we need to empty a facility, we have the ability to do that.
And one of the recommendations which was actioned was putting hand sanitizer in the lift, but why was there not hand sanitizer in the lift if one of the working theories of the outbreaks was the lift button transfer?
Well, there may have been hand sanitizer close to the lift, but not in the lift. So I think, all the way along, you look at what more you can do. All right, thanks very much, everybody.